Good morning. Today I am here to report that we have 5 new cases of COVID-19 in P.E.I. This brings our total number of cases to 41 since the pandemic began. The previously reported 36 cases have all recovered without need for hospitalization, and all of our cases of COVID-19 in P.E.I. have been travel related. These 5 new cases are essential workers who traveled to P.E.I. on July 30th from outside Canada. They all work in the same industry. These cases are all males, 2 in their 30s and 3 in their 40s. These individuals have been in self-isolation since arriving in P.E.I., and we are anticipating that they will have very few, if any, close contacts. Public health nursing is gathering information from these individuals today, including a comprehensive history and conducting contact tracing. We will know more about the potential linkages between these cases within the next 24 to 48 hours. These individuals are doing well and continue to self-isolate. They are being followed daily as part of Operation Isolation and will remain in isolation until they are cleared by public health. There is no indication of any community transmission in P.E.I. The detection of these 5 new cases shows that our systems are working well. These individuals have been in self-isolation since arriving in P.E.I. They were diagnosed on routine testing, and they have very few, if any, contacts. Although these new cases are not unexpected, this is not the news I want to share with Islanders on this beautiful day. These cases are not related to the Canadian Premier Soccer League, seasonal residents, or the Atlantic bubble. I have commented previously that our province is at risk of importation of COVID-19. I remain especially concerned, of course, about people coming to P.E.I. from outside of Canada. We know the prevalence of COVID-19 continues to rise in some countries. We must remain vigilant and maintain our existing processes to keep Islanders safe, including border security, pre-travel approval, the requirement to self-isolate, Operation Isolation and testing, especially of those individuals who have traveled internationally. The risk of Islanders contracting COVID-19 remains low, but it is important that Islanders continue to stick to the basics to protect themselves and others against COVID-19, maintaining physical distance, practicing good hand hygiene, and wearing a mask when enclosed indoor spaces. I ask, as I do every time, that Islanders continue to be patient, kind, and caring towards themselves and others. Thank you. And I'll open it up for questions.
Julien Lecacheur, Radio-Canada.
Bonjour, Dr Morrison. Qu'est-ce que vous pouvez nous dire concrètement en français sur ces 5 porteurs de la COVID-19? D'où venaient-ils et quelle sorte de métier faisaient-ils?
Bonjour Julien. Alors on annonce 5 cas ici à l'île Prince-Édouard. Ils sont les travailleurs essentiels. Ils ne sont pas des travailleurs dans la santé. Et puis ils arrivent dehors du pays.
Merci.
Merci.
Nicole Williams, CDC.
Hi, Dr. Morrison. I'm wondering, just to reassure the public, I'm wondering if what more you can tell us about the new cases, you know, where they work, why they came here, and where are they self-isolating?
Hi, Nicole. So I think we've said quite a bit about these 5 cases already. I mean, they are in self-isolation. They have traveled in from outside the country. They are essential workers, not in healthcare, and they do work in the same industry. And that is information that we want to make sure the public is aware of, and that they know that they've been self-isolating. and reinforces that the importance of the self-isolation, returning from travel, and we know the cases, the number of cases in certain countries is still increasing, and we're still seeing COVID-19 fairly widespread in a number of other countries. So I think, as I mentioned, it's not the news that we want to share, but it is that we have new cases, but the fact that we have these cases and that they are self-isolating and that they were picked up with our routine testing for international returning people to Prince Edward Island, I think says that we're doing some of the things and our systems are working.
Louise Martin, CBC.
Hi there. Yes, so I just doing a bit of calculations. So if they arrived on July 30th, they would have been quite close to the end of their 14-day of self-isolation. I'm just wondering if you can tell us how they traveled to P.E.I., whether it was a flight and whether there could be other people on that flight that would need to know that information, as far as any others that could potentially have become infected.
Hi, Louise. So yes, those returning internationally are usually tested between day 10 and day 12, and so that's why it looks like it's near the end of their period of self-isolation, and we are finding out further details. I mentioned public health nursing is in the process of doing that follow-up of cases and the contact tracing, and with that will come the details of any flights that these essential workers were on, and as in previous cases, those we let the public health agency know, as well as the airlines, and we post those flights publicly as well, and we'll speak to it, but I don't have the details of those flights at this time.
Okay, thank you.
Stu Neepy, The Guardian.
Hi, Dr. Morrison. I'm wondering if you can say a little bit more about where these workers traveled from, as in, was it within Canada, which province, was it internationally?
Hi, Stu, and I'm sorry if it wasn't clear. These 5 individuals traveled from outside of Canada, so they are international. It's international travel.
Okay, and what country are they coming from?
We haven't always identified the individual country, but it is not the United States.
Are they? So are these workers? Were they temporary foreign workers? Were they working in the agricultural sector?
Stu, we've, and I think others have asked the same kinds of questions, wanting more information, and we've said, we've given quite a bit of information here. They're essential workers in the same industry, and we've given their males and their ages, and they came in from outside the country, and that is certainly all I would be prepared to share at this time, and I think it's important for confidentiality.
Rachel Collier, Eastern Graphic.
Hi. I guess a question still left would be, how would something like this affect what happens with back-to-school plans? Yeah.
So, I mean, we've talked about what happens when we have cases and how they look different in different situations. So, these particular cases have all been self-isolating. There's no evidence of any community transmission, and we'll certainly do the contact tracing and the follow-up, but at this point there would be no indication at this stage that these cases would have any impact on back-to-school plans.
Okay, and would you have a timeline for contact tracing at all at this point?
But our contact tracing is usually all done within 24 hours and up to 48, but usually within 24 hours.
Thanks for that.
that's it. So thank you very much.